Yeah, hi everyone. Dr. WAN here again to make another interesting video. And this is done to please my regular patients and followers who took their time off to actually call me to persuade me to come up with this video, and it's dedicated to them as well as other followers. Please don't forget to subscribe to my Facebook page as well as my YouTube channel. So we are going to talk about circulation alongside with lipid profile. So circulation is just the ability of the human heart to be able to pump blood around the body. That's just, I want to put it simple. And for this blood to go around the body, we need two essential things. That is the veins and the arteries. They are just like tubes that the liquid flows in there. If the liquid can't flow in there, the organs will be in trouble. So that's in the layman terms, that's the meaning of circulation. So you could hear it tell you someone has poor circulation or slow circulation and lots of other things because of the density, the quality of his or her blood. Now, there are some what we call biochemistry form that when you go to your doctor or in a medical center, they advise you to do the test. It's kind of blood values that has to be done. So you present yourself there and they take your blood sample, send it to the laboratory for further analysis, then tell you what is going on. That form, I want to stress, is very important. Anyone listening to me should endeavor to get this done, especially if you are over 40 years of age. I repeat one more time. If you are over 40 years of age, whether you are healthy or you're not healthy, go and do lipid profile. So what is lipid profile essentially? When you go to any clinic of your choice, I am not here to advertise anyone. So feel free to go to wherever you want to go. What I'm concerned is getting that test done. It's supposed to be done at least twice a year. So take for instance, you do one on the 1st of January. I will suggest you do another one the 1st of June or 1st of July. So every 6 months, you get this thing done. So that's my advice to everybody. Having said that, there are some numbers that this form carries, kind of a range. So when they get this blood work from you, they analyze it. Now they give you those values. And if you don't fall within those ranges, it means there's something wrong. And that's when we see you are having circulatory problems. So take for instance, the value for calcium in your blood. It has a range. The value for magnesium, it has a range. The value for sodium, it has a range. Same thing for potassium chloride. Now, coming back to lipid profile, here we have 4 very important things to remember. You must make sure that that blood work taken from you, they check total cholesterol. That total cholesterol has a range. It should not be more than 200 milligrams per deciliter. The next one, it is HDL, which stands for high density lipoprotein cholesterol. That one should be less than 40 milligrams / deciliter, followed by low density lipoprotein, LDL, as we say, for cholesterol. And that one should be less than 100 milligrams of DL. And the last one is triglyceride. So if you cannot do everything, at least do those ones, and alongside with kidney function test, as well as liver function test. Now, the liver function test consists of 5 values. The first one is SGOT, and that one should be less than 38 units/L. Followed by SGPT, that one should be less than 40. Then you have GGT. You see, I don't want to give the full meaning here because some people will get discouraged and abandon the whole thing. So I'll just go by the acronym, like so. You find it easy going. So the key thing here is I want to see my values and then tell you how things are going with regards to your kidney or your liver. So those are the essential things that you need to make sure that you get them done. Then you have what you call bilirubins and other stuff. Yeah, so don't forget, get this done. And if you find anything abnormal, you can come back to me. Now, the last one I want to add, it is the one for diabetes. So for diabetes, I usually recommend what we call HbA1c. So HbA1c, essentially, it just tells you how your blood sugar it is. Is there any excesses of glucose, or there is less, and everything? And remember again those 3 words which I used last time, which I call them glycogenolysis, that is breakdown of glucose in your blood. And then we have glyconeogenesis, that's building up of blood. So you have what we call catabolic and anabolic effect taking place within your blood. So that's the essential thing. Then we have what we call gluconeogenesis, meaning that sugar builds up again. That sugar can build up because you have put on weight. Because I know somebody will tell me, oh, I don't drink juice, I don't eat bread, I don't do this, but I still have high blood sugar. Of course, because you have put on weight. So the system now is breaking down. That's why that value also is spiking. So in such a situation, I usually recommend what we call Ramadan or Lent. That is what we say fasting. So fasting could be either the 40 days for those who are Christian, Roman Catholic Christian, what we call Lent, or if we go the Ramadan way. So for Ramadan, I tell you, okay, you all know, you don't have to eat when you are in that prayer session. So they eat only in the evening. And the meal also should be light, what we say frugal. So frugal meal is what you have to practice when you are practicing Ramadan or Lent. You do not have to eat heavily. Remember that word, frugal meal. That's what you have to do to bring back that blood sugar value to normal. Now, having said that, in the event that the value are abnormal, definitely the healthcare professional who assess your result will be able to propose to you 2 things. The first one will be lifestyle, what we say lifestyle medicine. If the lifestyle medicine doesn't work for you, then medication might follow. So it's kind of putting together 2 things here, the lifestyle medicine and pharma. So we see how to manage your situation. Typical example for those who have high lipid profile are put on medication called the statins. I don't want to advertise any drug here, but I just want to give you a small box of it. You see that name is a statin. So that's one of the drugs. So there are various types in the market. There are about 10 types of the statin in the market that the doctor or the nurse or prescriber will recommend you to start with. I would suggest you pay more attention on your diet, what you eat. And this takes me back on the topic of dead food. When I say dead food, or food that has no life, they instead create trouble in your life down the road. So pay more attention on live food. Live food are those that keep you younger. And I'll give you examples to make things clearer. So dead food are meat and fish. I know people ask me, why meat and fish? It's simple. Go home and do this experiment. Get, say, half kilo of meat and 1 fresh fish. And then get anything green. It could be vegetable of your choice. Put them into various jars. Say 1 jar for fish, 1 jar for meat, and 1 jar for any vegetable of your choice. Clog them and leave them stand outside at a normal room temperature for 4 days. Go back and uncork those jars and try to smell them yourself. You will get a pungent smell from the jar that contains meat as well as the jar that contains fish, because those 2 things are dead. That's why they produce that pungent smell. The jar that contains green vegetable will not. There's no way it will produce a pungent odor in 4 days' time. So those 2 jars that has the meat and fish, they undergo what we call deterioration, putrefaction in medical biochemistry. So the various components, they are breaking down very fast within that time frame, and it is the exact same thing that happens in your body when you like eating so much meat without taking something green. So in the long run, those substances, what does it do? It provokes the organism, your body, to produce mucus in order to fight back the metabolite, for instance, the uric acid. And if that uric acid is not controlled, you end up having trouble down the road, because your heart will pump it down to the kidney, and then that's when trouble starts building up. So I don't want you to find yourself in that situation. That's why I'm making this video. On the other way around, if you choose to go with a lifestyle that is living on green, this is what will happen. Green food, I would say green leafy vegetable, are loaded with nitric oxide. Nitric oxide is a scavenger. It goes alongside within your arteries to clean it, to clean all the deposits that you've been eating meat and all stuff. So that's the role it does. So make sure you pay more attention in eating green food. They have to increase the flexibility of your arteries and your veins. That's what they do. If those organs, they are not flexible, your blood pressure builds up. When the blood pressure builds up, your heart also starts suffering. It has trouble pumping around, and you might end up having mild chest pain. That mild chest pain, a typical example, is when you feel like an elephant is walking on your chest. We call it crushing pain. Crushing pain is not a good news. Let's avoid it, because crushing pain can take you to your early grave. the heart can stop pumping. That's what we call heart failure or heart attack and all whatnot. So that's my message for you. Do not get yourself carried away with this meat story and the fish story. Focus more on green. And good example are green leafy vegetable. Then coming back to the sugar stuff, I will say no. You have to eliminate sugar, you have to eliminate salt, you have to eliminate oil. Now, why do I exclude oil? Oil should not be part of your diet, because when you take lots of oil, first of all, it creates acid secretion at the level of your stomach. That's one point. Then when it gets to the blood now, it goes around the arteries and create plastering in the walls of the arteries. And there's plastering there, they end up hardening up. When they are hardening up, they lose their flexibility and consequently blood pressure spikes. So that's my lecture for you. So take home message, make sure you go to the hospital at least twice a year, do what we call biochemistry test. And that biochemistry test has part of it called electrolyte, lipid profile, kidney function test, liver function test, and lastly, the one for diabetes. So far, so good. I don't want to talk much, but I want to leave it at this stage. And remember to subscribe on my page and also share it with your colleague. Thank you so much. I'm Dr. WAN. Have a wonderful day.